Hello everyone, I'm Carolyn Gonzalez and with me today is...
Hi, I'm Mallory Slack.
Today's presentation will cover periodontal disease and oral health instruction for patients in young adulthood between the ages of 20 to 40 years of age. So let's get started. I wanted to start by sharing this picture with you guys of Dr. James Potter, the dentist that I currently work for. Just to remind everyone that even dentists and dental professionals have to keep up with their oral hygiene to prevent periodontal disease. As I mentioned earlier, this video is geared towards patients in young adulthood between the ages of 20 and 40 years of age, and this is a patient presentation. I chose this topic for three reasons. First, the large number of individuals affected by periodontal disease. According to the Centers for Disease Control and Prevention, half of Americans aged 30 or older have periodontitis, totaling approximately 64.7 million Americans. Another reason I chose this topic is the link between our oral health and systemic health. Several research studies have suggested that periodontal disease is connected to a variety of other diseases, including heart disease, diabetes, and rheumatoid arthritis. And lastly, I believe that being knowledgeable about periodontal disease and knowing how to properly brush and floss will help patients prevent periodontal disease. The goals for my presentation are twofold. First, to compare healthy gingiva and periodontal disease, and second, to describe methods to reduce bacterial accumulation. Patient objectives for my first goal include describing the differences between gingivitis and periodontitis, identifying 3 risk factors associated with periodontal disease, and describing ways to prevent periodontal disease. The objectives for my second goal will be for the patient to observe correct brushing and flossing methods to remove dental plaque, and then the patient will demonstrate how to brush using the Bass brushing method and floss using a C-shaped technique. The instructional methods I will use are one-on-one instruction, including a PowerPoint and visualization tools, and demonstration and return demonstration on a typodont and in the patient's mouth. Before we get into what exactly periodontal disease is, I wanted to start by sharing this picture with you guys of the periodontium. The periodontium consists of the gingiva, cementum, periodontal ligament, and alveolar bone. And knowing these terms will be helpful in understanding what periodontal disease is. The periodontium exists in 3 basic states: health, gingivitis, and periodontitis. And this is measured through dental probing, in which the clinician measures pocket depths around the tooth to determine whether the periodontium is healthy or diseased. So what exactly is periodontal disease? Periodontal disease refers to inflammation and infection of the periodontium caused by bacteria. It includes 2 subcategories, including gingivitis and periodontitis. Gingivitis is a bacterial infection confined to the gingiva. It can also be defined as a type of periodontal disease characterized by changes in color, contour, and consistency of the gingival tissues. Onset is usually between 4 to 14 days after plaque accumulates in the sulcus or pocket. One important thing to remember is gingivitis is reversible. This means that through good self-care, the patient can bring the gums back to health after gingivitis has occurred. Periodontitis, on the other hand, is a bacterial infection including all parts of the periodontium that we discussed earlier: the gingiva, periodontal ligament, bone, and cementum. And it is characterized by inflammation, apical migration of the junctional epithelium, and attachment loss. Unlike gingivitis, periodontitis is permanent or irreversible. Once bone is lost, there's no way of getting it back. Clinical characteristics are as follows. In a healthy periodontium, the gums are pink, firm, resilient, and there are no signs of bleeding or attachment loss. This is shown in the picture to your right. In gingivitis, the gums are red, swollen, and there is bleeding present. And in periodontitis, the gums can be either pink or purplish, swollen or fibrotic, and bleeding is present along with attachment loss. I really liked this image because it shows the stages of periodontal disease starting from health, advancing all the way to advanced periodontitis. So what causes periodontal disease? Well, theories have evolved throughout the years. Before 1960, clinicians believed that periodontal disease was caused solely by the presence of calculus deposits. Then, from 1965 to 1985, clinicians believed adequate daily plaque removal could prevent or control the disease. Now it is believed that pathogenic bacteria and the host or the patient's response to this bacteria is what's responsible or the primary cause of the destruction in gingival tissues seen in periodontitis. And it is also believed that by eliminating or minimizing risk factors associated with the patient can help lessen the likelihood of developing periodontal disease. Well, what are these risk factors? They can be divided into two categories: local and systemic contributing factors. Local factors would be things like plaque accumulation, local oral conditions such as faulty restorations or malpositioned teeth, and cigarette smoking. Systemic factors would include things like diabetes and the use of some medications. And there is evidence that shows there is a direct link between periodontal disease and diabetes. Therefore, if a patient has control of his or her periodontal disease, this will have a positive influence on the state of the patient's diabetes and vice versa. So how can you prevent periodontal disease? Well, the best preventive measure is through daily mechanical removal of plaque through proper toothbrushing and flossing, and also periodontal instrumentation, which is performed by your hygienist. And this is why it's important to visit your dentist and hygienist twice a year for cleanings. And lastly, to prevent periodontal disease, you can eliminate or reduce local and systemic risk factors, such as quit smoking or make sure that you have control of your diabetes if present. Okay, so now that we've watched this presentation, can you describe the difference between gingivitis and periodontitis?
Well, the main difference is gingivitis is reversible with good oral hygiene habits, while periodontitis is irreversible.
Yes, and what are some risk factors associated with periodontal disease?
Some risk factors are smoking, uncontrolled diabetes, and not maintaining good oral hygiene habits.
Yes, and how can you prevent periodontal disease?
You can prevent it by visiting your dentist regularly and brushing and flossing daily.
Yes, exactly. Now that we've established that removing plaque is the best preventive measure in preventing periodontal disease, let's get into how this is done. For brushing, we will use the Bass method approved by the American Dental Association, and for flossing, we will use the method suggested by the American Dental Hygiene Association. Here are a list of 6 steps on the Bass method, also known as circular brushing, but let's take a look at a video and see how this is done. Today we're going to be using the Bass brushing method that's approved by the ADA. So you want to start by angling your toothbrush towards the gum line at a 45-degree angle. You want to insert the filaments just below the gum line into the sulcus, and you want to vibrate the toothbrush back and forth about 10 times. Then you can move to the next 2 to 3 teeth and repeat those same steps. And you want to do this across the maxillary arch, the mandibular arch, as well as the facial and the linguals of the teeth. You also want to do the tops of your teeth. When it comes to the front or anterior teeth, you want to stand the toothbrush upright, and you can use a heel to toe method. So you make sure that you're accessing every part of the tooth surface. You can see if you use the Bass method, you just aren't able to access it as well. So go ahead and stand it upright and vibrate back and forth. So Mallory, would you like to demonstrate for me?
Sure.
Good job. Yeah, so just make sure that you angle it at a 45-degree angle. This way you massage the gums and stimulate the blood flow. Yeah, great job. Thank you. Here are a list of steps on proper flossing technique, but let's take a look at a video and see how this is done. You floss, you want to start with a piece about this big. In the video we mentioned 18 inches, as long as it's long enough. You want to start by wrapping this around your middle fingers. The first few times you may do it a little too tight or a little too loose, you'll get used to that. But what you basically want to do is leave about an inch between the floss. If you have too much floss between your fingers, it's going to be hard to kind of control or manipulate and wrap it around the tooth. So you want to leave about an inch. I'll go ahead and hand you this mirror so you can see. So what you want to do is kind of do a zigzag motion between the teeth.
Once you're between the teeth, you want to angle or shape it around the tooth in a C shape. You want to go below the gum line and up, and you want to do this about 4 or 5 times, vertical strokes, not horizontal because you're not removing plaque, and that's the purpose of flossing. So you want to go up and down, and then the other side of the tooth. I say 4 or 5 times, but you can do it as many times as you need to, as long as all the plaque is removed. You can come up with a method. I always start on the top right, work my way all the way around, and then come to the bottom and work my way this way. If you want to go ahead and try that for me? Sure. I'll take this for you. Good, yes. Great job. And I guess the biggest 2 things to remember, and a lot of things that I see patients doing, making mistakes, is not going below the gum line and removing all the plaque, and then using horizontal strokes. So as long as you use that method, you should be in good shape. Thank you.
Here are a few other things I wanted to mention about brushing and flossing. When it comes to picking a toothbrush, you want to use a soft or ultra soft toothbrush, and it is recommended to brush a minimum of 2 minutes twice a day. In addition, you want to avoid aggressive brushing or horizontal strokes because this can cause toothbrush abrasion or wear on your gums. Flossing, on the other hand, should be done a minimum of once to twice a day. You want to use vertical strokes and make sure that you wrap the floss around the tooth and go below the gum line to ensure that all the plaque is removed from the sulcus or pocket. Now let's review. Our first goal was to compare healthy gingiva and periodontal disease, and this was done by the patient describing differences between gingivitis and periodontitis, identifying 3 risk factors associated with periodontal disease, and describing ways he or she can prevent periodontal disease. The second goal was to describe methods to reduce bacterial accumulation, in which the patient observed correct brushing and flossing methods, and also demonstrated how to brush using the Bass brushing technique and floss using a C-shaped technique. For evaluation purposes, a pre-test was provided, as well as a post-test. And lastly, a teacher evaluation survey. Thank you guys for tuning in, and now if any of you have questions, I'd be happy to answer them.